Hi, this is Gretchen Haig, and this is my final video presentation on sexual violence. So the definition of sexual violence is any sexual act that is perpetrated against someone's will. Sexual violence encompasses a wide range of offenses, including rape, attempted rape, abusive sexual contact, such as unwanted touching, and non-contact, like sexual abuse or threatening sexual violence, exhibitionism, verbal assault, and harassment. The first circle of sexuality is sensuality. This refers to body image, pleasure stimulators, and feelings of attraction are often violated when an act of sexual violence is experienced. Many of those who have suffered from sexual assault or sexual violence suffer from feelings of unattractiveness and shame as a result of their trauma. Sexual acts are no longer viewed in a positive light and now seem fearful. Rather than having fantasies, the victim now has nightmares. It is important to reveal these feelings of shame in order to attempt to reverse or lessen the long-term effects. Intimacy is one of the most crucial components human beings possess. Human beings have a biological urge to form secure attachments with others. When intimacy is violated so grotesquely as often occurs with an event of sexual violence, establishing this attachment in future can seem nearly impossible. When treating a client who suffers from a violation of this magnitude, it is crucial to focus on reestablishing trust in the individual. If the survivor does not come to terms with this violation and together, along with a therapist, is able to rebuild or reestablish some trust in the world, the client will be unable to form meaningful relationships in the future. Sexual identity can also be called into question when someone experiences a traumatic sexual event. Sexual identity is how a person understands themselves to feel and as it relates to a particular gender. How a person defines themselves in terms of gender does not have to be congruent with how they appear outwardly to others. While a victim may look a certain way, they may feel differently, and this can call for a different path to recovery. This path may be more or less difficult depending on how the victim perceives themselves to be, as well as the gender of the perpetrator. It is important to listen to a client's story and pay attention to clues while not assuming anything. The fourth circle of sexuality is reproduction and sexual health. This circle focuses on a particular area of repercussions associated with an experience of sexual assault. When a person is violated on a sexual level, one not only needs to be aware of the emotional results of the trauma, but also the physical ramifications that can come after the initial physical violation. While the process of seeking medical attention can be tough and has the potential to be re-traumatizing for the victim, it is important for therapists to do their best to encourage their client to see a medical doctor. Explaining the process to the client is a good way to help ease anxiety and perhaps make them feel more comfortable to seek the advice of a physician. The fifth and final circle of sexuality is sexualization. This circle describes the way in which the idea of sex can be brought into an interaction. This can include flirting, seduction, sexual harassment, and even rape. The evidence of pervasiveness of sex in society is clearly depicted in TV, movies, video games, and on the internet. Almost anything can be sexualized and often is. As a clinician, this can be challenging when treating a patient who has been violated in a sexual manner. Sex is virtually all around. Our society has deemed sexual jokes and behaviors to be an acceptable form of communicating and interacting with one another. Trauma-informed care should be at the forefront of every practicing clinician's mind. The ability to be trauma-informed is a crucial element that sets social workers and mental health professionals apart from others in the helping profession. Being trauma-informed can and often is a decisive force that can deter or encourage individuals to seek treatment. The Adverse Childhood Experience Study, or the ACE study, examined the effects of adverse experience over a lifetime. The findings on this topic showed that 1 in 8 men have experienced emotional trauma, 51% of the population of the United States has experienced some sort of childhood trauma, and an astounding 98% of those who are serviced by the mental health industry have experienced some sort of trauma in their lifetime. These statistics show how crucial it is that everyone involved in the mental health field is trauma-informed and aware. An example of being trauma-informed could be for a practice or an agency that primarily sees victims of rape or sexual assault to have well-lit parking lots close to the building. Even the availability to only see patients during the day so they don't have to be alone at night can be helpful. The lighting in the office can help relieve anxiety and ease a client's mind as much as possible. A social worker's job is to do meaningful work with our clients. This is virtually impossible if the client feels unsafe. The likelihood they will open up and engage with the clinician is minimal if they feel uncomfortable or a repeat attack is a potential risk to seeking treatment. The concept of social justice is a just society that expands beyond the legal interpretation of the law. While we do not always live in a just society where resources are shared and individuals and groups receive the same opportunities as others, it is the role of a social worker to work as hard as possible to even the playing field, even if it's only a minute amount. As social workers, we are always working towards social justice for all. When dealing specifically with clients who are victims of sexual violence, we need to not only look to treat the victim, but also the perpetrator if possible. Everything we know as human beings is learned behavior to some degree. In order to bring an end to this cycle, we need to bring an end to the mentality and stop the thought process before it can be passed on to another generation. Rather than continuing on the path of defense and treating only those who have suffered the traumatic event, steps should be taken to prevent the attacks from occurring in the first place. While many feel women, for example, should always travel with others or should be sure to wear long enough shorts to send the message that it's the victim's fault or that they somehow antagonize the situation by wearing provocative clothing. This idea not only mitigates any movement towards social justice, but it also gives more power to the perpetrator by creating some level of an excuse for their actions. The truth of these sort of violations, however, has very little to do with the physical look of a victim. Both men and women are targeted for different reasons, but the basis that many attacks or assaults have in common is the need for control. Once this basic factor is acknowledged, real work can be done to change the mentality of those who feel this way and can prevent more violence from occurring in the future. And these are my references. Thank you.